Hello everybody, I am Dr. Raja Ramesh, consultant interventional cardiologist working in Aster Ramesh Hospital, Vijayawada. I am here to share a rare case with you which we have done in our lab 1 month back. So we have a patient, 75 years female, who came to us with breathlessness. So on diagnosis, we found that she is suffering from severe aortic stenosis, which means there is a narrowing of the valve which is between the heart and the main blood vessel of the body called aortic stenosis. Due to this, the heart is unable to pump the blood into the rest of the body. So this will be treated traditionally by the replacement of the aortic valve surgically, that is opening the chest and replacing the valve, which is a high risk. So in this high risk patient, there is an alternative approach which is commonly used in our country called TAVI, transcatheter aortic valve replacement. So in this procedure, without opening the heart, we can replace the valve. So usually we will go through the artery of the thigh, that is called femoral artery. So through which we will pass the valve into the heart and replace it. But in our patient, there is a fat in the artery of the thigh and in abdominal aorta, that is the main artery of the body. So due to this, there is a restriction for us to go through the traditional route. So we have chosen a novel approach called carotid approach. The carotid artery is the artery of the neck and the brain. So we have cut open this carotid artery, through which we have passed our aortic valve into the heart and replaced it. After that, we have successfully repaired the carotid artery, and post-operatively the patient is doing well, and since now one month we have follow-up, she is doing well. So in all the patients where there is a difficulty in approaching the heart from the traditional arteries like femoral artery, there are different arteries we can choose. One among them is the artery of the neck and head, that is the carotid artery. So through this artery we have successfully replaced the aortic valve and then the transcatheter aortic valve implantation. Thank you.